Although it's possible to contract the flu virus at any time of year, doctors' offices and emergency rooms see an influx of patients with flu-like symptoms during the months of October through May. The flu usually isn't an emergency and generally goes away after a few days of rest. However, there are certain groups of patients that have a higher risk of developing complications, and those with those severe symptoms should seek immediate medical care. So it's first important to distinguish whether you have the cold or a flu. The cold is going to be less symptomatic symptoms or less severe symptoms. So look at loss of appetite, sore throat, sneezing, cough, and headache. Whereas the flu, on the other hand, is going to have muscle pain, high fever, fatigue, chills, and vomiting. If you're in a high-risk group and experiencing symptoms like fever, chills, or body aches, seek medical care immediately. It's vital for at-risk groups to receive urgent care to avoid potential complications like hospitalization, pneumonia, bronchitis, and even death. Your high-risk groups include pregnant women, people over the age of 65, and those with a weakened immune system. So severe symptoms to be alert for with adults: difficulty breathing, shortness of breath, severe chest pain, severe stomach pain, persistent and severe nausea and vomiting, and sudden severe dizziness or ongoing dizzy spells. If we're talking about children, we're looking at a blue tint in the skin, extreme irritability, not drinking enough fluids, or in infants a lack of tears when crying, or fewer wet diapers than usual. Rapid breathing, difficulty breathing or shortness of breath, or the inability to eat or drink. You can avoid potentially dangerous illness by taking a few simple precautions during each flu season. First of all, get your flu vaccine. The best thing to do to prevent contracting the flu virus is to receive your flu vaccine each year. Despite myths and misconceptions surrounding the flu vaccine, being vaccinated does not cause the flu. The second best step is practice proper hand washing. Scrub the front and back of your hands between your fingers and underneath your nails for at least 20 seconds, or about the time it takes to sing happy birthday. If you don't have access to soap and water, use hand sanitizer that contains at least 60% alcohol. If you've already contracted the flu, do yourself and those around you a favor and stay home. Prevent the spread of the virus by avoiding contact with others, even if you have to skip household chores, work, or school for a few days. And if you are experiencing severe flu symptoms, it's important to be seen at an ER right away. As always, you can contact your local emergency room. They're ready to care for you 24/7. And in the event of an emergency, please call 911. Thank you.